Claims Department, Ernestine Tomlin. Nope, not covered. We consider that an elective procedure, meaning we elect not to pay for it. Well, it's not our fault you've had 2 heart attacks. You should have stopped at 1. Of course you have your choice of doctor. Do you want the doctor we give you or not? It's your choice. You must think HMO stands for Help Me Out. Remember, your health is our business, not our concern.
California One Care. Full care for all for less.
Welcome to Progress in San Diego. Ordinary People Doing Extraordinary Things. I'm your host, Walter Davis, and I have with me Mr. Hugh Moore of One Care Now. Mr. Moore, you want to talk about that film clip that we just watched?
Yeah, Lily Tomlin graciously volunteered to help our organization's Healthcare for All. The video you just saw is a 30-second slot that she did to advertise the campaign, California One Care. And the California One Care campaign is going to be one 30-second slot presented over the internet every day for 365 days. Lily Tomlin is the first one. We have people like Sally Field, Elliot Gould, who are going to be doing slots, and there's going to be people doing slots who are regular citizens. So if you have your own story that you want to tell about what's happened to you because of the healthcare problems in our country, you can make a video and submit it to California One Care, and it might get turned into one of these advertisements. With any luck at all, we'll collect enough money that some of these ads will actually be run on television. But right now it's a internet campaign. And all of that is to support the SB 810. That's the healthcare reform bill that's being placed in the California Senate right now. In fact, just yesterday, SB 810 made it out of the appropriations bill, out of the appropriations committee in the Senate. And so now it goes before the Senate floor to be voted on, and hopefully it'll be passed. SB 810 is the same bill that used to be called SB 840. SB 840 was presented by Senator Hugh, and it was passed by the Assembly, passed by the Senate, and was vetoed by Governor Schwarzenegger 2 times. SB 840, which is now SB 810, is a single-payer health care solution for California. And that bill, which is presented right now, passed by Senator Leno, passed out of appropriations right now, and hopefully will be passed by the Senate shortly. We hope will be passed through the Assembly, and then will again be placed on the governor's desk before the end of the year.
So tell me, who is Hugh Moore? Tell me about you right now. I want to come back to that SB 810.
We'll talk more about SB 810 and the bill in a second. My name is Hugh Moore, right? I'm a nurse. I got started working on Healthcare for All about 6 years ago now. The reason why I did was I was working for my patients and repeatedly had to make phone calls to my patients telling them, well, this is what the doctor wants you to have, but you can't have that because your insurance company says they won't cover it. And over again, I had to make that phone call. And it occurred to me, why is it that the patients aren't getting the care that their doctor is recommending? And what is it that this insurance company has to do to help with care? And the truth is, the insurance company has absolutely nothing to do with helping deliver care. It is a third man, a middleman, and their whole purpose is to make profit. We can say that the insurance company is the bad guy in the healthcare situation, but the actual truth is the insurance company is doing what they're supposed to do. Their responsibility to their shareholders is to make profit. The only way that they can make profit is to limit the care that is given for the people who they insure. So unfortunately, even though they're doing their jobs well, and they really are doing it extremely well, making tremendous amounts of profit, that them doing it well prevents clients from getting the care that they need. And so what we need to do is we need to get away from having insurance companies controlling healthcare. We need to get back to doctors controlling healthcare. And that's what single-payer healthcare is all about, making the doctor-patient relationship what actually covers healthcare.
Now, I can certainly attest to that because in 1989, when I returned from the Iran-Iraq War, my pregnant wife and daughter were shot in the head in Los Angeles. and the insurance companies didn't pay death benefits and they didn't pay medical benefits for my son and for my family. So I began to study insurance, and I got my insurance license. So as an insurance broker, I now specialize in insuring patients that have cancer and diabetes. I show them how they can get major health care plans. And certainly I have no allegiance to insurance companies. And I see how they wreak havoc. I have people paying $1,300 a month for insurance plans, and they don't have prescription drug coverage. So an insurance company can override your doctor. So what you said, they can interfere in terms of you getting quality care in order to reap a profit. And that's really a tragedy, isn't it? That these insurance companies can turn people down, they can cherry pick, they can pick the people they want to cover, and they can deny treatment to patients. So what I'm hearing you say is that SB 110 has some features,
SB 810
has some features in it that can assuage this, that can make this part of the patch. Can you tell me more about that?
Well, SB 810 is what's called a single-payer healthcare plan. What happens is everybody is put into the healthcare system. Everyone pays into the system, and then the money that's paid in by everyone is paid out by this one care system, this one group plan, basically, to cover everyone's health care. Now, what that means is insurance companies go away. This would be a government-run plan, but it isn't that the government would be paying for it. It's that we as individuals would pay into it so that we would be cared for. And instead of having a person trying to make a profit from health care, which is what the insurance companies do, the whole system is set up so the only thing that matters is patients getting health care. There is no profit being taken out of it at all. For instance, right now, with most insurance companies, they take what's called 25 to 30% of what the money is paid in, your insurance payments that you make, and turn that into what they call administration, but most of it is profit. Medicare, one of the best run health care plans in the country with the greatest patient satisfaction, ask anyone who's retired if they want to lose their Medicare, absolutely not. They only spend 3% of their funds on administration. So right now, if you take 3 from 30, that's 27% of money that you are spending to your healthcare coverage that is not being spent on your healthcare. If you take 27%, that's a lot of money that can be used to cover things like full dental, glasses, certainly going to see your doctor without copays. And I set this one piece of paper out here because I wanted to remind myself the cost savings continues to go on other than just you individually and your insurance company. For instance, the San Diego County Unified School Board spends on health care $147 million. Now, if you take 16%, you take the 27% that you're usually giving that to the insurance company, you take that away, the unified district is going to save $22 million every year. Now that's $22 million that they can spend on books, that they can put more teachers in the classrooms. Mm-hmm. And even more important than that, that's $22 million less that's being spent, and every teacher will get better care. And every student will have insurance. So instead of kids coming to school and having to go see the school nurse because they don't have a doctor that they can see, every child will have their own doctor. And every student, every teacher will get actually better care. They won't have copays at all. And all of that comes about very simply because you save so much money when you remove this profit motive from healthcare. And that's what the real basics of SB 810 is all about, is the morality of healthcare. Martin Luther King said, the greatest injustice is injustice in healthcare. If you have inequity in healthcare, you can't explain that. A doctor goes to see a patient. A doctor can't ask you, can you pay me? The doctor has to take care of you. Okay? And that's what has to be the base root of healthcare. And that's what single payer does, is it makes everyone get care. And when you start caring for everyone, you get health care for every single individual, you actually get a benefit to society by society operating better. Right now, a tremendous amount of people don't go to work because they can't get health care. Well, if they all have health care, then you lose or you diminish that amount of days that you lose at work. You get a more productive society. The amount of ways that you save money by having everyone cared for just multiplies over and over. And my biggest problem with understanding what's happening in Washington right now, and we've heard a great deal about the 60th senator being lost, Massachusetts losing a Democratic senator. Mm-hmm. Well, the plan that they're suggesting in Washington right now is a plan that keeps insurance companies in the loop. Mm-hmm. Why? Why do you want them? It makes no sense.
Right.
They're not offering anything. They're not adding anything to the package. They're not offering any better care for anyone whatsoever. If you get rid of them, you save all of that money going into their profit, mm-hmm. and you give that to doctors to take care of patients.
So what you're really talking about here is reforming the way that healthcare is financed.
Right, not healthcare. We're reforming only the financing part of healthcare.
Now, what is your response to people that say things like, well, illegal immigrants, they're going to get health care coverage under this plan if we bring in the SB 810?
Well, illegal immigrants get health care right now. There is something called COBRA. Any person who shows up at an emergency room cannot be turned away. They have to be stabilized first. So you're caring for illegal immigrants right now. But the real answer to that is SB 810 will only cover residents in California. And right now, what does a resident mean? A resident means someone who is legally in the United States. And for most statutes, like if you are a resident of California, you get a decreased tuition at SDSU or at the community college. And the residency requirement is 6 months. And so right now, I'm imagining SB 810 would start out with something like a 6-month residency requirement, and you would have to be a legal resident. If you weren't legal, you would be an illegal resident. Now, would you receive care? The truth is, yes. And you want to give them care, because if you don't, then the disease that you need to give them care for that they're bringing into the country isn't being treated, and it spreads. For instance, San Diego right now has a tuberculosis epidemic. You go to county health, you ask them, they'll tell you there's an epidemic of tuberculosis in San Diego County. Why? Because we have an influx of illegal immigrants that bring tuberculosis with them. That tuberculosis is not treated. It spreads to everyone in the county. So whether or not you want to treat them, whether or not you want to pay to treat them, you're going to pay someone to treat something. I would suggest it's better to treat them than treating the 100 people that they're going to give it to.
So preventative treatment is much better than them going to the emergency room and that kind of thing, and much more cost effective.
Preventative treatment is much more cost effective, not only for illegal immigrants, but for all of us. And everyone knows that. Any person who's gone to see their doctor for their physical, their doctor has told them to do what? Exercise more, lose weight, right? What is that about? That's about preventative medicine. And you can do so much more by doing preventive medicine, so much more to decrease your health care bills overall. And of course, that would be part of SB 810. And another thing that we don't often think about when we talk about health care and about health care reform is, what is the initiative, what is the incentive to make healthcare reform work better? Well, for instance, if you have healthcare insurance companies, their incentive is to make profit. If you have healthcare system that the government is running, their incentive can't be making profit. Their incentive would be to reduce costs. How do you reduce costs? You reduce costs by providing better care and providing preventative care. And by providing preventative and better care, then you spend less in the end. And that's one of the reasons why you save so much money with having a single-payer system.
Exactly. Now, this seems like a no-brainer, but I don't know if people understand that a lot of our politicians are being paid off by the insurance companies to make sure that we don't get universal health care coverage, and to the tunes of millions of dollars are being paid to our local senators, and that can be obtained, on particular websites. That information is readily available. We have people being paid as much as $1.7 million in terms of congressmen and this county right now. So with that kind of system, and you've also talked about the senator in Massachusetts, where are we right now in terms of getting universal health care? Does it seem to be dismal, or what do you think? What's going on?
Well, I'm glad you asked that question. For the last year and a half, myself, Healthcare for All, Physicians for a National Health Care Plan, have all been speaking of in favor pushing single-payer health care. But none of these organizations have been speaking against the federal reform plans that have been going on in Washington right now. But 2 weeks ago, when the Senate finally came out with its plan, Physicians for a National Health Program finally came out opposed to the federal plan. Because what they said was that plan, even though it would cover some additional people, was actually so bad that it would make things worse. And what they meant by that was people would be forced to buy insurance from companies that were not being limited on what they could charge. So in other words, a company could charge you anything. It's true that they couldn't restrict you from having a prior condition. They had to insure you, but they could charge you anything. So if they want to charge you enough, you can't afford to pay it. It's the same thing as restricting you. So at this point, there's been a tremendous amount of news about the 60th senator no longer being available. And my personal opinion is that that's actually a good thing. Because as bad as I hate to say it, as much as I hate to say it, I'm actually in favor of the federal reform failing at this point, and that there be no reform. If it's going to be without a public option, or if it's not going to be single payer. Because right now, what they've done is they've given the insurance companies a windfall. And you don't have to believe me about that. All you have to do is go look at the stock market and look at how much insurance stocks have gone up in the last month. They've gone up because they got what they wanted. So with the loss of that Senate seat, the prospects of passing any health care reform in the Washington, D.C. right now is very questionable. And from my viewpoint, I think it's a good thing. Now, I'm not concerned what's going to happen in Washington with health care reform, because we're going to make health care reform happen in California. And that's what Healthcare for All is working on in our California One Care campaign. We're going to continue to put out these videos every day for 365 days. We've got tremendous support. Many of the unions are on board. SAG, Screen Actors Guild, is on board. That's the reason why these actors are able to make these video commercials basically for us. CTA is on board. There's actually many businesses who are coming on board now, because they're discovering that just like the savings that San Diego Unified would get, they will save money from not paying insurance companies this extra money. Basically, what we come down to, if SB 810 passes, is 16% of payroll being spent on health care. In many cases, companies are paying as much as 25% of payroll on health care. And at 16% would be divided up between 10% from the employer and 5% or 6% from the employee paying into the system. This is a tremendous amount of savings, and businesses oftentimes in our state are not able to compete with businesses from foreign countries because their insurance costs are so high. So there's a tremendous amount of support here. Like I said, this has passed the Assembly and the Senate twice in our state already. It is only not already operating in our state because the governor has vetoed it twice. Will the governor veto it again? Maybe. We're continuing to try to create enough pressure that we will get him to pass it and not veto it this time.
And so, but it also may be encouraging that we may end up with a Democratic governor in the future.
If Governor Schwarzenegger does veto it this time, then there's absolutely no question that Healthcare for All will put this on the ballot. I mean, we'll put this on the Assembly and Senate floor again the next time. And the next year after that, assuming that there is a Democratic governor, the SB 810 is part of the State of California Democratic Party's platform. I don't see how a Democratic governor could vote against it, could veto it, when it's actually part of their platform right now. And it's been part of their platform for the last couple of years. And of course, we would recommend that it become the national platform for single payer, but that hasn't happened with the Democratic National Party yet, but we're working on it.
So California may end up leading the way again in the future.
Just as they did in Social Security, where California, the state of California, was the first state to enact Social Security, then it spread across the rest of the country. Just as California enacted the most stringent smog protection laws against cars so we would have better air quality, and that has spread across the country. California has very often led the way, and we're going to do it again with healthcare.
Well, that sounds very promising. Now, what can the public do to assist you now? What do you want to convey?
Absolutely. The biggest thing we have to do is contact our senators and representatives. They are, like you said, being paid by insurance companies to not vote for it. Because let's be real, insurance companies in the state of California is $1 billion business. You know, we're talking billions of dollars. And they're not going to go away just because we asked them to. They're going to spend, you know, if they have to, $2 or $3 billion next year to fight this. How can we beat them? We beat them by having individual activists. Every single citizen who says healthcare is not right the way it is, we've got to change it. You got to call your representative and your senator and tell them it's got to change. And if you do, it will change.
Okay. Well, more information is obtainable by coming to the Community Coalition website.
Absolutely.
Your logo is on there, everything, and people can find out more. The website will appear at the end of this broadcast, and my telephone number you can call, and I can put you in touch with Mr. Moore here to get more information. You're very passionate about this particular thing. I've seen you over the years. You've been very consistent with your drive toward this. What's really the, you know, what's the fuel behind that? What makes you continue to move on?
Well, the same thing I said right at first. I'm a nurse, and I take care of my patients. And I see this as an extension of my profession. I cannot take care of my patients if they don't have health care. I'll give you an example. This past week, I admitted a 17-year-old to my hospital. Why was he admitted to my hospital? Because his parents couldn't afford to buy the medications that were required to not have him be admitted. All they had to do was have health insurance. And if he had insurance, he would have the pills he needed. He wouldn't be admitted to my hospital. So not only would we save money as a community, but more importantly, this is a 17-year-old man who is now being admitted again to the hospital because he was there before and is leading to not being able to finish his high school diploma. Shortly, he's going to be homeless, all because we're not providing the appropriate health care that we need to provide. And like I said, I'm a nurse. I care for my patients.
So then I'm sure that you can vouch for the fact that things like having HER2 positive breast cancer, you're looking at $28,000 a month for Herceptin, for example, chemotherapy, and radiation treatment can cost as much as $700 per day. And you got to go to radiation treatment every single day, in some cases for 30 days straight. And I'm wondering, how would you handle that if you got a medical bill like that and you didn't have insurance, like many of our neighbors do here in San Diego? They find themselves in a situation where they can't have their medical coverage, medical care covered.
The number one reason why people go bankrupt in the United States is because they can't pay health care bills. And let's be understanding about this thing. Those aren't people who didn't have health insurance. Most of those people who end up going bankrupt because they can't pay health care bills had insurance when they got ill. They became ill, they were unable to continue working, they lose their insurance, and now they go bankrupt. This is why we have to stop having an insurance plan based on employment. This is why the government has to get involved, why every single person has to be covered from birth to death. And in the end, even with the prices you were talking about right there, we can easily cover that. We spend over $6,000 per person in the United States on health care. And that's for the people who have insurance. 47 million people have no insurance. But we're still spending $6,000 per person for every one of those people who don't have insurance. Where's that money going? It's going into profit for insurance companies.
And we're in 40th place, last place, and many categories, right, in terms of comparisons to other countries. People would be surprised to know that some so-called third world countries are actually more advanced than we are in terms of providing better health care coverage.
According to the United Nations, we're number 37. And if you go on YouTube and look up "we're number 37", there's a really funny video on guys singing about the United States being 37th in the world in healthcare. And it's not funny, but it is a funny video. But basically, we're between Cuba and Slovenia.
Well, you know, I'm really happy that we got a chance to get you to come on the show. This time has gone by so fast. We're definitely going to have you come back again and talk some more about this and keep us updated in the future. Meanwhile, I encourage everyone to go to the Community Coalition website that's going to appear at the end of this broadcast to get more information about One Care Now and our efforts to gain universal health care. We have to have this for our citizens. It's a tragedy that people are out here without health care coverage, and those that even have insurance, as you mentioned, can go bankrupt and not have health insurance. I want to welcome you and thank you for coming to the San Diego County Community Coalition and Progress in San Diego. It's truly our honor to have people like Mr. Moore come aboard and talk about positive stories here in the community. I want to remind you that we are the story here in our community. We don't have to rely upon major media conglomerates to cover our stories. We can do that for ourselves. And that's what we have here. We have all volunteers here behind the cameras. We have people of all walks of life, all races, all genders. We welcome you to come and join our crew and become part of our television crew and learn more, or become part of the audience here. I encourage you to watch our show. We come on every Sunday at 6 p.m. here on Cox Communications, Channel 18 in North County and 23 in Southern San Diego. And we have Community Issues, a Tapestry of Concerns, that comes on at 6 p.m. and Community Artist Connection with the executive producer Laura Thompson that comes on Thursdays at 9:30. Thank you very much for joining us.